So, greetings, friends and followers. This is Nurses Talking. I am Del Barzi. And as always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I am very, very pleased to welcome Natalie Evenson. Natalie is a Master of Science in Nursing, and she's a nurse and health content writer. She has 25 years of nursing experience in critical care, emergency, trauma, orthopedics, and perioperative nursing. She's also an adult and pediatric sexual assault nurse examiner, and she's an expert witness. Welcome, Natalie.
Thanks, Dale. It's nice to see you this morning.
I am so appreciative of the fact that you are here. It gives me an opportunity to speak to you as a nurse and as a sexual assault nurse examiner. I haven't had one of those yet, so thank you for this. But firstly, why are you a nurse? What brought you to nursing?
Well, it's been a long time, but growing up, I always knew I wanted to do something in healthcare.
Okay.
I always thought, well, maybe I want to be a doctor, and then I thought, I don't want to go to medical school. I don't want to go to school for that long, and I don't like science enough to do that. Growing up, my dad was real sick, and so there was a
Oh,
lot of experience around the hospital.
okay.
Um, then I thought, well, gosh, what about being a nurse? And that kind of led my path to becoming a
Yeah,
nurse. Really.
yeah. And so when you got there, was it what you thought?
You know, yes and no. I think
Mm-hmm.
I mean, as you just don't really know what to expect. I feel like my program prepared me to, jump right into the floor, take a full patient load, hit the ground running. But I wasn't prepared for all the other dynamics that happen in the hospital. I started at the level 1 trauma center. And so there's a lot going on there besides
Yeah,
just, intense, medical needs. There's a lot of psychosocial, mental health, just
yeah,
all that other stuff.
yeah.
I was like 20, it's my
Yeah,
early 20s and trying to tell adults to, stop behaving like children. It was a big learning curve. And, I don't think anyone can really prepare you for that.
mm-hmm. Yeah. So I get that. I get that. What was the biggest thing though that you think you had to overcome?
I think it was, and now I realize there's a word for it, like imposter syndrome. Like, oh my gosh, somebody's giving me this degree. I'm a nurse now and I'm responsible for these people and, making sure that,
Yes.
they make it through the night and that, I'm doing all the right things. And
Yeah.
I worked at, a teaching hospital. And so these brand new residents would roll in and ask me what to do. I'm like, I've been here for a month. I don't know what to do. You kind of sink or swim and, but I was given a lot of great support and really helped me learn and grow as a new grad and kind of,
Yeah.
took it from
But
there.
the,
It just, yeah,
and,
God.
and and looking at the areas that you worked, as I just read your bio, you worked in the adrenaline pumping kind of thing. You
Yeah,
is that
I
what drove
love
you?
trauma.
Yeah, I can get that. I can get that because that energy and that adrenaline thing that you get with in those kinds of areas, it's not even something that you can describe.
It's not.
It's not even something you can describe. I know.
And it's hard because it's like I loved it. It's just intense and it really does take a lot out of you. And, I don't do the trauma intense stuff anymore.
Mhm.
So I've just taken a step back from that. But it's fun, but it is really, I think it's so important for nurses to remember to, really be aware of, your own needs.
Yeah. 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 So as you since you said that, you brought me to something I would have touched on later because we talk about this all the time, and that is taking care of yourself.
Yeah,
Um, and very often as nurses, it is the last thing on our agenda, if it appears on our agenda at all.
right.
Um, and so that's one of the things that I talk to every single person about, regardless of where they are. I bring it up because, I think like it's something we have to recognize and articulate and recognize that it means different things to different people. So what does self-care mean to you?
Um, well, going back to the, I mean, as years ago, nobody really ever talked about self-care for nurses.
Yeah.
Really, it wasn't until, I mean, at least I didn't really start hearing anything about it until, the COVID-19 pandemic,
Mm-hmm.
you know, which is great that finally people are talking about it. Because, I can't tell you, I mean, I'm sure as how many shifts at the entire 12 hours, eat, didn't sit down, didn't, and it's just emotional and just continues on. So, um, and then at the end of your stretch, you're just so exhausted. It's like you don't have time or you don't have the energy to do anything to, take care of yourself or really, yeah, be kind to yourself, So it is
Yeah.
it is so important. And yeah, I try and be a lot more aware of that now. Whether it's, getting out for a walk or, like I have animals. So, spending extra time with my animals and, just
Yeah.
kind of whatever it is in your life that, soothes you, makes you feel good, gives you a break from the, intensity of life. Because there's
Yeah.
also, personal life on top of, professional life.
Yes.
I think
Yeah.
that's so important. Yeah.
Yeah. Yeah. Yeah. And just as we put ourselves behind, we put our whole personal life actually after our professional life. I think we need to learn to put it the other way around.
Yeah.
Our professional life is important. Our personal life is everything.
Right. I think that's the hard thing. We're nurses, so we're,
Yeah.
it's kind of by nature. We always put everybody else first, which is hard.
Exactly. It's by nature and it's by education and training. Uh,
Yes.
it's just reinforced every single time. And, in fact, sometimes we kind of like pat ourselves on the back about how hard we work.
Right. Right.
I mean, get over it. We're so proud of the fact that we worked, 12 hours. Well, okay, but what happened at the end of that?
Right. Right.
You know,
He went home and collapsed. Yeah. Is that good? Yeah.
no, 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 it cannot be. It cannot be. It cannot be. It cannot be. And so that led a lot of nurses also into burning out.
Right.
We just push through and somehow you just keep going. But it leads to a lot of what we're seeing. A lot of people talking about their burnout and stuff like that. So how do you think we can recognize this before we get to this stage? Because it's going to happen. It doesn't just happen with nurses. I think that we got to this because we didn't recognize it. We didn't have the tools to see it coming. How can we do this?
I think just now that we're starting to talk about it is a huge, just a huge improvement. um, it wasn't even acknowledged, like we said. So I think that, and then getting employers to get on board with, it's important to have, to
Mhm.
have break.
Yeah, there's a lot that I think that we could see. What's the biggest thing you'd like to see change, though?
Um, well, I would like to see, nurses just knowing that, like what you're doing here today, there are so many more options than just working at the bedside. When I graduated from nursing school, it was you go work in the hospital, you work in the community, or you work in the nursing home.
Hmm.
And ever mentioned any other options. I had
Right.
no idea, until over the years I just kind of discovered, gosh, nurses are everywhere.
Yeah. Yeah.
Yeah.
Yeah, I know. I know. One of the things that started me down this path, well, I really wanted to talk to nurses for a long time, but one thing that really energized me down this path is the thing of talking to other people. And the reason, you can't, if you tell someone that you're a nurse and you work from home, and they get this glazed over look, like, ah. Like, oh, no, 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 we have to clear this up.
Right, right.
Yes, I can. Yes, I can, and I'm still a nurse, and I'm still a
Right,
nurse.
exactly.
Yeah. So now you segue into you've become a sexual assault nurse examiner, right? So one of the goals of this channel actually is to, as I said, to expose nurses. I have a nurses. So explain to us as for people who are looking, how do you get into that, and what does it involve?
Yeah, so and this is actually one of the things that I've been trying to do, just bring awareness to forensic
Yeah.
nursing. A lot of nurses, again, don't know that forensic nursing is
That's mhm.
special. And one of the largest areas of forensic nursing is sexual assault nurse examiners. So we are nurses that specialize in performing or in caring for patients who have been sexually assaulted. A lot of these programs are focusing more into combining a sexual assault nurse examiner with doing domestic violence exam. So it all comes under the umbrella of forensic nursing. And if somebody wanted to become a sexual assault nurse examiner, most programs are based in hospitals. There are some programs that are based out of at child advocacy centers. Um, so, apart from the hospital, but generally most SANE nurses work just part-time per diem, typically an on-call position. Of course, no one can predict when, violence will happen, and it's very unpredictable. It's hard work, it's emotionally taxing, there's a lot of reasons why people don't want to do it.
Mm-hmm.
Um, but it's important work, and I think it's so important to our patients to provide that service. And there are sexual assault nurse examiners nationwide. Definitely not every hospital has them. It would be wonderful if we could have a SANE nurse in every ER or every hospital. Forensic nursing also includes our nurse coroners. There are nurses,
Yes, yes.
child abuse, elder abuse,
Mm-hmm.
you know, um, drug abuse, substance abuse. There are so many, or legal nurse examiner, legal nurse consultants. There are so many
Yeah,
different,
yeah.
specialties that fall under forensic nursing. So I
Under
think,
that umbrella, under that umbrella. Yeah, so that means that you get to work very closely with the police department and the legal system, yes?
yes,
Yeah,
yes,
awesome,
definitely. Our
awesome.
main priority is to our patients. We do not work for
Mm-hmm.
them, but we work closely with them to,
With them. Mm-hmm.
assisting our patients. Yeah.
Yeah, yeah. And I don't know if this is the right word because clearly someone has been sexually traumatized, but it's for me listening to you, it's a very exciting field.
Mhm.
It is a
It
very
is.
exciting. Yeah.
Yes, and I've been doing this for 19 years, and the technology has just come. I mean, it's phenomenal how far technology has come with, DNA and how long they can, collect
Yeah.
evidence.
I can imagine. I can imagine. What would you say though, is your greatest achievement so far?
Um, so that's a tough one. I'm very goal driven. I kind of
Mm,
I want to learn this. And then I learn
mhm,
it. And then I'm
mhm.
like, okay, well, I'm going to do that for a while. And then I want to learn something else. So I'm constantly, looking
Yeah.
to, what else can I learn? What else can I do? That's what I love about nursing. There's always something new to learn.
Yeah. And as I say often, um, if you didn't want to learn something, then nursing is not for you. And as long as you're a nurse, you're going to learn something, whether you wanted to or not. You're going
Right.
to learn. And you're going to continue learning things.
Right, right. Uh,
So how do you see, though, over the last few years, you said you've been doing this for 19 years, you have 25 plus years experience. So over the last few years, what I've seen is that nursing has just exploded. All kinds of different things have come to the forefront. How do you see this going forward in the next 10 years or so? What do you think it's going to look like?
Well, I just think, gosh, especially for new nurses, there are so many opportunities out there. I think it's a great time to go into nursing. I think it's really challenging. I know it's first of all, it's hard to get into nursing school because there aren't enough, educators.
Mhm.
Um, and, I think a lot of people may be discouraged or, not so interested in going into healthcare right now after seeing, hearing all these stories of these poor healthcare workers during,
Yeah, yeah,
COVID and, all that. So I
yeah,
think it's kind of discouraging, but gosh, we need nurses. We just need nurses. It's such important work. And, um, there are just so many options, out there to, and I really um, see the need for more forensic nurses out
yeah,
there.
yeah.
Um, it would be great to have forensic nurses working in like ERs because there's so much, police can't be there for every,
Exactly.
yeah. And a lot of that, it's goes right along with forensics. They're trying to build a
Mhm.
case, they're collecting evidence in the ER. A forensic nurse could be right at the bedside during a trauma, collecting clothing, doing documentation, doing photographs while the trauma team is doing a resuscitation. It can all
Yeah.
be, very smoothly
So,
together.
yeah.
You know,
Yeah, 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 yeah.
uh,
And so as does that automatically lead you into becoming a witness?
um, not necessarily. SANE nurses can be deemed an expert witness based on education and experience. Um, there's plenty of
Mhm.
SANE nurses out there that don't ever testify. A lot of our cases don't ever even, get
Make it.
to, yeah.
Mhm.
Um, but they do use SANE nurses just because of our expertise. We know how to interpret, first of all, the medical jargon.
Yeah,
We know the standards of care are, and so we can look at a case as a third party and just objectively say, the standards of care were followed. This injury is or isn't, or I don't know, consistent with, what
yeah,
the history,
exactly.
so it's a really interesting um, nursing nurse. Yeah.
Yeah, yeah, yeah. I'm sure it is. I'm sure it is. And as you say, so many more are needed um, in so many different areas because very often people are assaulted and it's not taken as seriously as it could be.
Right.
And perhaps if a nurse was there who had the expertise at the
Mhm.
time when when someone's brought in, let's say to the ER, the whole thing might have had a different look.
Yes, yes, exactly. And I think a big part of that is just starting with, after something happens, like it takes a lot of bravery just to tell someone that,
Yeah.
horrible thing happened to me and I need help. A lot of people
Yes.
don't disclose and they keep it inside and it's just so traumatic. And I think it's really valuable having someone who's trained in if you show up to the ER,
Yeah.
and oh yeah, yeah, go over here, I'm busy, and so there's a big push for trauma informed care. That means treating
Yeah.
patients um, kindly and preventing re-traumatization. And SANE nurses know how to talk to patients, how to explain things. And really, a big part of our job is kind of giving power back to our patients or victims after they have gone through an
Yeah.
experience. have completely lost power. Well, we're here that we're there to care for them and to give them whatever services that they decide that they would like to have. And whether it's just having a discussion, whether it's having a full exam and collecting evidence, that's great. But it's up to it's their choice. What
Right.
they do, it's all in in their
Yeah.
power.
Yeah, yeah, and I'm really glad you mentioned that because that's one of the big things that happens when you're assaulted is that you feel, or at least feel, powerless, and if someone can give that back to you as soon as possible, that is huge.
Right. Yeah. Just to make it through just to make it through the next couple of hours, it's just
Yeah,
terrible. Yeah.
yeah. If you can have help with that, it's huge. Yeah. So you kind of touched on it before, but what kind of advice would you really give to someone who wants to be a nurse? Someone who in this climate says, I thought I wanted to be a nurse, but I don't know.
Yeah. And I do hear that a lot. And I do encourage people, I'm like, I think it's such a great profession. I've been doing this for a long time. I love being a nurse. I'm proud of being a nurse. I think that it's a job that gives you so much flexibility just in the schedule that you work. You could work weekends, you could work days, you could work nights. It's great for, if you have a family, if you have a dog. I mean, just like those kinds of things, so just for quality of life. If you want to travel, you can,
Yeah,
be a travel nurse. Again, I just see so much potential especially in the future of nursing right now. And I think it's still such a great option.
yeah.
And I to see more, you know, more nurses or more people going to nursing school and coming through. Yeah, because so many people are retiring now.
I know, I know, I know, I know. I really would like to see nurses take our own power back. Um, Give ourselves permission to acknowledge that we are a powerful force. Um,
Right, right,
because we tend to somehow um fade into the background. We promote other people. We stand behind other members of the healthcare team and all of that.
right.
We are the backbone. We can stand in front.
Right, right. Yeah, you're right. We are the backbone of.
We can stand in front. It's fine. We can do this. So, one more thing. What would you say is let me rephrase that question. If you had to describe the most essential quality of a nurse to you, in just one word, what would that word be?
Oh yeah, flexibility.
Flexibility. Good
Uh,
one.
In in my career, it has served me well. Just being able to roll with the punches. You never know what's going to happen. It's like, okay, well, okay, we're going to change gears. We're going to figure it out. It's just kind of okay, well, this isn't going as planned. We're going to figure this out together. So
Yeah,
um, that being flexible, having a positive attitude, it's and just working together. I think it's so important.
yeah, yeah, yeah. And,
Surviving.
and, and you said twice in that last sentence, you said two words. You said figure out. We're going to figure it out. And that's a lot of what nursing is. A
Yes.
lot of it is figuring it out on the spot.
Yes.
Because,
Yes.
the same thing does not necessarily present the same way
Right.
5 minutes in a row. So,
Right. And it doesn't, every situation does not work for each patient. So you really
no,
have to,
not at all. Not at all. Not at all. Not at all. And you get to realize that your education, as thorough as it may be, is still really just a guideline. It's a guideline for you to follow, but you're gonna have to figure it out on the spot.
right. Yeah. Yeah.
Yeah. So before we go, Natalie, is there any little gem you'd like to leave us with?
Um, well, again, I just like to encourage nurses to hang in there, keep, keep with the profession. There are so many options that you can, you can pursue if you're tired of being at the bedside. And forensic nursing is a wonderful option. There are forensic nursing programs across the nation, and they really need you. And, I think it's such valuable work, and I encourage people to, to look into it. I love it, and I think other people extremely interested in it too.
Yeah,
So.
yeah. Natalie, thank you so much for doing this. On that note, thank you so much for doing this. I really appreciate it. I enjoyed this conversation. Thank you.
Thank you so much.